Are you a woman who suffers from difficulty emptying the bladder or your bowels, where you find that you have to lean forward to empty your bladder or lean back to empty? You have to strain really hard to empty your bladder or your bowels. You feel like low pressure in the pelvic area or low back discomfort, or you just feel like there's something that may fall out the vagina. Well, if you have noticed any of these things, you may actually have the beginnings of what we call pelvic organ prolapse. And prolapse is where there's a drop of either the uterus, the bladder, or the bowel into the vagina that can cause these symptoms. And I'm Dr. Tugbiyele. I'm a board certified urogynecologist and top doctor in urogynecology in Atlanta, Georgia. And I've cared for thousands of women with pelvic organ prolapse who have these symptoms. And so a question I will get will be, how can Kegel exercises or pelvic floor muscle exercises help me with these symptoms? You know, before a woman feels a bulge in the opening to the vagina, they actually have all these symptoms and all the things that you're feeling happen way before the bulge becomes apparent down below. So Kegel exercises are what we call pelvic floor muscle exercises that help to strengthen the muscles that support the pelvic floor. So if you think about the Kegel exercises, those muscles are like the basin of muscles that support the bladder, the vagina, the rectum, and the uterus in women who still have a uterus. When a woman has had a hysterectomy, meaning when the uterus has been removed, then it's the vagina, or the vaginal cuff. So these muscles act as a support structure down below that remain relaxed but toned. And when there's good tone and strength to these muscles, they provide support to a woman's pelvic floor to help to prevent prolapse. So in order to keep them strong, we have to do what we call Kegel exercises. So you squeeze these muscles. And how do you know you're squeezing the muscles? These are the muscles you would squeeze to stop the flow of urine midstream, or you would use this if you felt like you had to go to the bathroom. You would squeeze these muscles to keep yourself from peeing on yourself. Or if you're not in the right place to pass gas, then you would actually hold it in. Or if it's not the right time to have a bowel movement, you would kind of squeeze these muscles, and that would, kind of make the urge go away to have a bowel movement. And so these are the muscles that you would squeeze, and exercising them means you would squeeze and let go, squeeze and let go. And then there are ways to squeeze the muscles to build endurance. So you'd squeeze them and hold it for like 10 seconds and then release, and then squeeze again and then release. And that helps to build an endurance in these muscles. And then there are times when you actually want to be able to recruit these muscles really quickly. So rather than holding, you would squeeze, let go, squeeze, let go, squeeze, let go. And it's very important to do these exercises regularly, because the stronger they are, the better they will be at supporting your pelvis. And when your pelvis is best supported, that can help to prevent prolapse later in life. And so for women in between having children, for example, or for women who have early symptoms of pelvic pressure, low discomfort, maybe the beginnings of a low, as if something is falling out the vagina, that can be the best time to do these exercises, because it can help to prevent if there is prolapse, from it getting worse, or it can actually help it to prevent it from the get-go. Because we know that once prolapse of the bladder, the vagina, the rectum, or the uterus, once it reaches the opening to the vagina, kind of where the muscles are or beyond the muscles, it's really going to be very difficult to get those muscles to work for you. And so squeezing those muscles is really going to be helpful to help to prevent prolapse or treat it when things are really, really early and mild. And so you've heard of the saying, an apple a day keeps the doctor away. Well, I like to tell my patients as a urogynecologist, 100 Kegels a day keeps the urogynecologist away. And so doing these muscles exercises regularly and doing enough of them is going to be very important to help protect and strengthen your pelvic floor. And so rather than waiting for the bulge to occur, these are exercises that I encourage my patients to do regularly to help to prevent prolapse. Pelvic organ prolapse is a very common condition that affects many, many women. Up to 25 to 40% of women in their lifetime can develop prolapse. Women who've had children, women who, as they get older, particularly women in their menopausal years, women who've had a history of heavy lifting, or who have had multiple children, are at greater risk for pelvic organ prolapse. So it's not something that a woman causes, but just the course of the things that occur in a woman's life can increase the risk of developing prolapse. But thankfully, nowadays, there are good options and solutions to help to prevent the prolapse from starting or from getting worse. And so one of the ways, as I mentioned, is pelvic floor exercises or Kegel exercises, doing those muscles. Again, doing them really and holding it for 10 seconds to build endurance, and then also doing them rapidly to be able to recruit them quickly, it's going to be very important to protect your pelvic floor. So just wanted to share this with you to help you to be able to do these exercises properly to prevent prolapse later in life. And if you're looking for a urogynecologist that you trust who is for you and is interested in helping you to prevent prolapse, I can be reached at my website, www.drtugbiyele.com. And I practice in Atlanta, Georgia. And I'll see you in the next video.